Welcome back to America's Retirement Headquarters, home of the Retirement Guys formula and America's Medicare Associates with Nolan Baker. 419-794-3030 is the phone number. The website, arhq.com. Thanks to advances in technology, we are living longer and longer. And as medicine progresses, we get more reasons to spend money on our health. Here's comedian Greg Warren.
Probiotics, you know what that is? There's a war in my stomach between good bacteria and bad bacteria, and I'm sure you've heard wars cost money, and my good bacteria costs $100 a bottle. But here's the good news. I read the bottle. Each pill contains 360 billion colony-forming units. So per colony, very affordable.
Now, as medicine progresses, we get more reasons to spend money on our health. There's no dodging the fact that healthcare only gets more expensive as we age into retirement and beyond. How do you help plan for that with your clients?
A huge part of what we do here at America's Retirement Headquarters. In fact, it's home of not only Retirement Guys Formula, our investment arm, but it's home of America's Medicare Associates, who, many of you heard from Scott Kirshner talk here on the show, talking about, that is a full-time job that he does. Troy does that full-time here. And then also we have Dan helping out as well. So we've got 3 dedicated people that are working on helping people navigate the landscape of what is out there. We had somebody that we had just met with the other day, and these folks had retired, went on Medicare, and never realized that they had the ability where they could sign up for a zero-cost premium Medicare Advantage plan. And that is kind of one of those, again, things that we felt was a no-brainer to add on to their Medicare coverage that they have, because Medicare by itself, it leaves you a big 20% gap. And, Scott would normally be on the show, but right now during that annual enrollment period, I know he is kind of back-to-back meeting with people. Mm-hmm. It's not too late. If you're nearing 65 and or 65 or older, now is the time before the beginning of December that you have the opportunity to review what your coverages are if you're 65 and older. And with the Inflation Reduction Act that's coming in, for 2025, that is going to have an impact on prescription drugs. And so what there is there's a cap on prescription drugs. And a question that I would ask is, if the government is going to cap what the actual out-of-cost maximum that a Medicare recipient is going to pay at $2,000, are the insurance companies of America, are they going to lose money on that deal? Are the prescription companies going to want to lose money on that deal? And, traditionally, I would think the answer is no. And
Right.
so what happens is, who's going to pay for that cost? And so what you could see, in my opinion, is you could see some of the Medicare plans start to reduce and or eliminate what prescription drugs they're going to cover. So it's important, if you're in a Medicare plan, make sure you're paying attention and or get a review by our office to understand what changes are happening within your plan. And many times people will buy a plan from, calling one number, and maybe they're working with a captive company. The problem with that is, does that captive company know the plan changes of all the other insurance Medicare providers that are out there? Oftentimes not. And if so, are they going to recommend their plan working for a captive company, or are they going to talk to you about, what the plan is offered from the company up the street? The great news about America's Medicare Associates being an independent firm is we have the ability to help kind of shop out all of those choices. And, help you take a look at what is could be maybe the best supplemental plan in your situation, what also could be the differences of what's happening with the Advantage plans. I have seen personally the Advantage plans get a lot better in what their benefits are that they offer in the last couple of years. But those are important decisions. Now, the other thing when you look at the cost of health insurance is we also help folks out that are pre-65. So if you're going to retire before the age of 65, you essentially have 3 choices. You have a COBRA, you have a short-term plan, and then you have the option to go on the Affordable Health Care Act. And those strategies make a big difference. Dan and I were meeting with a gentleman last week. He's retiring. He's got the last couple of months ultimately has the ability to go on Cobra. With his plan that he has today, he's maximized most of his out of pocket. He's had a couple of health things that are going on. Probably going to get a couple more health things that he needs to have finish up before the end of the year. And so he's trying to figure out, do I take Cobra now? Do I get a short-term plan, or do I go on to the Affordable Health Care Act? In his situation, it probably makes the most sense to take Cobra throughout the rest of the year, but then January 1st, look to switch over to the Affordable Health Care Act. The other good news with him is because the Affordable Health Care Act is an income, not an asset test. What we can do is we can look to make sure that we can take and kind of reposition his assets to make sure that we can help keep health insurance affordable until he gets to that age 65. And so if you're going to retire next year and you're going to need health insurance pre-65, you're going to want to take steps this year to test out what your income levels are going to be. And that way, how are you going to pull money from? Are you going to take money and convert it from your 401k to a Roth IRA so it's not countable income next year? Are you going to pull money from non-retirement sources? And if you're going to pull income, what is the optimal amount of income that you want to have to get the correct affordable health care for your family situation? So we also help people that are pre-65. And then the last issue is looking at the issue of long-term care. When you look at long-term care, we're talking about the cost traditionally of a nursing home, but it's more than that. It's more about helping you maintain control and independence. And when we look at long-term care, what we talk to folks about is we talk to folks about the different options. So option number one is do nothing, right? There's nothing that says that you're going to need long-term care during your lifetime, but I would say take caution with that, because if you look at what the cost is of ending up in a nursing home, if it's $9,000 or $10,000 a month now, what's it going to be in 10 or 15 years from now? Mm-hmm. You could buy traditional long-term care insurance. With traditional long-term care insurance, I think it goes back to what the beginning of this, and that is healthcare costs are going up. So with traditional long-term care insurance, what you have seen is the insurance companies of America are continually to raise the rates on most of the policy holders. So you want to look at the rate renewal history of the company. You want to look at how long your rate guarantee, if you have one, is in effect. And then third, we can look at things like veteran business. So again, as a veteran-owned company, there could be ability to get some veteran benefits. Now, dealing with any type of government agency, you've got a lot of red tape. I think the application alone is more than 60 pages. It's important, I think, to work with a veteran service organization and or work with somebody who specializes in understanding, navigating how the veteran benefits work. And if you're a veteran, first of all, thank you. But if you haven't, even if you're healthy now, I think it's important to have a conversation with the Veteran Service Office. We've got a great one here in Toledo, understanding what your benefits look like. Third is looking at leveraging your assets. Usually some of the best options that I like to take a look at for people. So in leveraging assets, it's things like adding riders onto life insurance that would allow you to accelerate your life insurance benefits if you needed help with one of your chronic illnesses, being defined as your inability to perform those activities of daily living. And then there's also annuities. Annuities offer enhanced income payments. A lot of those income payments in life or annuities are not designed ultimately to pay for the full cost of a nursing home, but they're designed to help you leverage your dollars. So in the event that you needed long-term care, you have more income. And again, when we develop a plan, what we're working on first and foremost is we're working on a plan that's designed to help keep you out of a nursing home, to help you maintain control and independence. So when you're looking at the planning for rising costs of healthcare, again, the comprehensive approach that we take here at America's Retirement Headquarters is that team action plan. So we're talking about taxes, estate planning, asset protection, and money management. That asset protection section is an area where we're going to walk you through how to figure out navigating health insurance if you retire before the age 65, understanding what are the changes coming up in 2025 and beyond for Medicare and the difference between supplemental and advantage coverage, then looking at long-term care planning and how to protect your assets, hopefully without buying traditional long-term care insurance, but doing it while you're young and healthy so you don't have to do crisis planning in the future as well. So lots of different choices. Again, another area that we can help you with planning for the rising cost of healthcare.
And all it takes to get started is reaching out, setting up a time to start establishing that retirement team action plan. 419-794-3030 is the phone number. Again, you can reach out 419-794-3030. You can also find out more about the team, learn about some of the processes, that retirement team action plan in and of itself, and set up a time on the website, arhq.com.